Thank you very much for the opportunity to talk to the ladies. After the hysterectomy, they also removed my ovaries because due to the weight of the fibroids.
I think there's a bit of a challenge with hearing, so we just want to modify the...
Okay. Due to the weight of the fibroid, it had pressed the ovaries and it was rotten. The doctor who did the surgery said the ovary was rotten and she had to remove it completely and try her best to make sure that there was not going to be an infection. So I didn't know what would follow after that because I didn't get any information and I also didn't know where to go after that. But after it had been removed, then I started experiencing muscle pain. I would get very severe muscle cramps. Then my skin started becoming dry. I was irritable, very irritable. And I had fear of having sex because I knew that my uterus had been removed and I was not having any desires for having sex. So there was fear around that as well. And then when I tried to have sex, it was so dry, very, very uncomfortable. And I didn't want anything to do with it. I didn't know how to explain it. So my partner was like, what is the problem? Why are you behaving like a 15-year-old? I mean, what's happening? What is all this? And the relationship became very rocky because of that. And then I started sweating. Like I would be sitting somewhere and I'm sweating like it's raining all over. My hands, my knees, my pride, everywhere, I'm just sweating, which was very uncomfortable. I thought it was my ARVs or what exactly was happening. Then as I ended up also, I'm just seeing right now because I also have those heart condition. Mm-hmm. I have also heart condition. And what really scared me is that I became very anxious. Anxiety was a very big issue. And then the other thing is I didn't know who to talk to, even among my peers. I didn't know who to tell about what I was going through. And at times people would just make fun, like the men. When maybe a woman was annoyed, you'll see them say, don't bring your menopause here. So it's like, it was a kind of shaming. So those components of it. And in the CCC, nobody talks about it. In the HIV clinic, nobody talks about those issues. Even when you bring up what you're going through, the clinicians is like, that is something they brush off. They only want to know about your ARVs, whether you are bearing, and that's it. Go and pick your medication. So that is what I was going through at that particular time.
Thank you very much. And so in all of this time, have you had the opportunity to speak to anybody about menopause, clinicians, for example?
No.
And were you offered any treatment? Were you offered hormones or?
I've not had any treatment to date.
Okay. And so how did you manage your symptoms? What did you do yourself? So for example, the problems with sex, have they gone away or?
The one with sex was terrible. Yeah. I kept off. We don't live close with my partner. So I would really get a lot of excuses like I'm busy, I'm going for this meeting, I'm not available. I would make all types of excuses. And when he was around, I would really make myself busy like until 2, washing this, doing that, writing. I'm just on my phone, I'm working, so that at least he can go to sleep because I don't want to be bothered. And then he will get disappointed because I'm so dry. Then I thought, okay, I could use KY jelly. But then how do I introduce it? How do I say this is what we need to use, like the KY jelly? So I'll do it privately, like, I know you maybe want sex. Then I'll go just in the bathroom and put it on so that all is well. But I'm suffering on the side. I'm the only one who knows. And I've not had the opportunity to talk to a gyna or even the medical staff who are working in the different CCC where I go. I've not had anybody to give me any information, apart from now what I'm able to read online. Yeah.
Thank you. And so the experiences you describe are the experiences of many, many women, and women all over the world. Women from everywhere have these experiences. And we find, in my experience, that they don't know who to speak to, and so thinking about women living with HIV, I think it's the same experience that you have. Most clinicians will focus on the HIV. Even if you did mention that you had menopausal symptoms, because people don't really have experience in managing menopause, they brush it off, or they say go back to your GP and let the GP talk about it. And in the end, I think women just get so tired of not being heard, of not having anybody to help them, that they just stop asking. And I think that this is something that we really need to be aware of. And so you say that you didn't have support from the people looking after you sort of in the clinic. Have you been able to speak to other women? Do you know other women going through menopause, and have you been able to be supported by them?
We've only spoken in passing. We've not had like a very deep conversations. We only make fun. Like maybe when we are in a meeting and everybody's holding something to fund themselves, and then we say we have our own weather. That is how far it goes, that, oh, we have our own weather, you know? And that's it. So we've not, I think it would be paramount that maybe we start something for women who have menopause, that we can have our own support system, maybe have our own support group. We need to start from somewhere, and I think maybe this is a place where we start. That we need to look for support for women who are going through menopause.
Thank you. And there are places in which this support exists. And as I was sort of doing the work, the research for this talk, there is a woman called Sue Mbaya, M-B-A-Y-A. I can't remember where she comes from, but she does a menopause podcast. And she has looked at menopause provision across Africa. And in Botswana, there are groups of women who come together and they exercise, they run, I think in Zim the same. And so there are groups of women in lots of countries in the world who come together to support each other. So finding such groups, and if you can't find one, as you say, starting one yourself is really important, because peer support is so important in this area. And so I'm going to ask you another question, which is, what advice do you have for women who are approaching menopause? What would you say, for example, to a woman who is not yet menopausal but potentially is reaching menopause age in 2 or 3 years? What advice would you give her?
I would encourage that women already start looking for facilities where they can be taken care of, especially maybe trying to get a gyna who is affordable, because gynas don't come cheap. I've gone for, I had to see one once, and it's not cheap. So if gynas can be available within the public health system, that would be the best. Or even within, like for us who are living with HIV, within the CC clinic, but as well to start talking to their clinicians in the CC clinic about what they are going through now, and insist for answers, because when we go to the clinic and these people are not answering, we just go away quietly.
Yeah, thank you. We still have time, but actually I think it would be quite nice to have a bit of extra time for Q&A. So I would like to say thank you very much. Really appreciate your experience, hearing your experiences. And there will be women in this room who are experiencing the same. And what I would like to say is that this should not be something that you should be ashamed of. Menopause is not something to be ashamed of. And there is so much stigma associated with menopause. And one of the ways to stop this stigma is for us to talk about it openly. So thank you very much for your attention.